As we continue recognizing Women's Health Month, our next guest is urging women to stop waiting until something feels wrong and instead take a more proactive approach to protecting their long-term health. She's here to talk about the screenings, tests, and tools women should know before symptoms become serious health issues.
Please welcome renowned OBGYN and co-host of the SheMD Podcast, Dr. Thais Aliabadi. I'm going to say this right. Dr. A. Say it correctly.
Thais Aliabadi.
Oh
I know, it's a mouthful,
practice,
you guys.
Dr. Aliabadi. I even practice. But she is known, of course, to many as the Kardashians' OBGYN. Dr. A, as she's known, has cared for and delivered celebrities' babies, including Hailey Bieber, Rihanna. She helped actress Olivia Munn detect her breast cancer through proactive screening. Thank you so much for being here today.
Thank you for having me.
Aliabadi. Do I have it?
Yes.
We got it. Dr. A, Dr. A. Okay, so before we dive into these specific topics that we're covering this morning, we want to start kind of with the bigger picture. You say women really need to think about their visits to the doctor more than just an annual pap smear. Maybe we get a mammogram every year, maybe every 2 years for some. What do we need to be thinking of in terms of our long-term overall health?
So women have been taught for years that a well-woman exam is a pap smear, a breast exam, maybe an STD check, maybe a discussion of birth control, and maybe a mammogram at age 40. So we have to change the way people think about a well-woman exam, and we have to start looking at women as a whole. You want to address their metabolic health, their cognitive health, their brain health, gut health, bone health. You want to discuss fertility, genetic testing, lifetime risk of breast cancer, their sleep, their eating disorder, all of it during this visit. And you want to not only listen to them and diagnose the underlying condition, but also really address preventative care and get them ready for a long and healthy life. So if a lot of these women show up to the doctor's office complaining of irregular period, brain fog, weight gain, acne, hair loss, facial hair, and the list goes on and on. However, they're told that your symptoms are normal. So that needs to be changed.
How often, or let me back up, I have 4 daughters, my wife and
Me
I.
too.
I get up top. So my question becomes, and when should you start caring about all these things? I guess the obvious answer is, right away. But I mean, in general, when should a woman start?
I would say 3 years after they become sexually active, or age 21. So very early. And all of these things need to be addressed at a very early age. And we can talk about it today.
Yeah.
Let's get specifically into hormone and metabolic health. Polycystic ovary syndrome affects millions of women. They don't even realize it. I want to talk about this specifically, but I also want you to please cover how women can have these conversations with their doctors, because I have a lot of friends who complain often about the doctors not bringing up these conversations. It becomes kind of your responsibility to be your own advocate.
Yes.
Yeah.
So let's talk about PCOS, and I'm happy to say, so polycystic ovary syndrome, and as of today, May 12th, I'm happy to announce it on TV that the name has changed to PMOS.
Oh.
So it's called polyendocrine metabolic ovarian syndrome. So now we call it PMOS as of today, not PCOS. It affects 15% of women. Millions and millions of women are, have PMOS, and they're never diagnosed. 75% of these patients go through life. No one ever diagnoses them. It's the leading cause of infertility. And in order to diagnose PMOS, you need to meet 2 out of 3 criteria. Very simple. 1 is history of irregular periods. 2 is PCOS morphology on ultrasound, which is a specific finding on ultrasound, or really high egg count for this second category. And the 3rd is symptoms of high testosterone. It could be facial hair, body hair, acne, hair thinning. PCOS patients tend to have mood disorder, they're anxious, they have PMS, PMDD, they struggle with depression. 75% of them gain weight, and no matter what they do, they cannot lose that weight. And a lot of them have eating disorders. I say, if you want to find these PMOS patients, go knock on the doors of these eating disorder centers, and they're all sitting behind those doors. And it's the leading cause of infertility. And can you believe that majority of these patients are never diagnosed?
So I really want to make it easy for our audience and make sure that we're all on the same page. PMOS. That's the new way to label it. What is it again?
It's the most common endocrine disorder in women of reproductive age, and it affects their ovulation. They have irregular periods and symptoms of high testosterone, like acne, facial hair, body hair, hair loss. These are patients who are anxious. They struggle with depression. They have binge eating, cravings, food disordered eating or an eating disorder. 75% of them gain weight, 25% of them are lean.
So might they discover this if maybe they're trying to have a baby? And is this connected
dealing
to
with
that?
it and don't know what to call it.
Right. And even when they end up in the fertility clinic, they're still not getting diagnosed.
Oh, wow.
So it's a big issue.
So what can women do? I mean, if many of them are sitting there and going, that's me, but my doctor has never mentioned anything like this.
So what I did, because of this frustration, I have a platform called Ovii, OVII.com. I have a free quiz. I encourage women, if you're listening to this and you think you have PMOS, go on the website, take the quiz, and I can tell you whether or not you have the likelihood of having PMOS. And if you have it, you can take the supplements, but it's important to educate yourself. I have the SheMD podcast that I started mostly for these PMOS patients to educate themselves and learn about this condition. Go to your doctor, ask for ask them if they agree with your diagnosis, number one, and ask for other lab tests besides the regular pap smear and STD. Ask for your thyroid panel, ask for your prolactin, ask for your testosterone level, DHEAS, ask for them to do your egg count, which is an AMH simple test. Ask for a pelvic ultrasound and be your own health advocate.
And that's beyond normal blood work, right?
Yes.
Like everything you described sounds like
Yes.
not something they're just going to randomly say you should do. You should ask for these things.
Correct.
And is it something that insurance covers, or is
Yes,
this something?
it should. Absolutely.
Okay.
Absolutely.
Let's talk about reproductive health specifically, because I know you say that this is something that women should be really paying attention to earlier than later, which a lot of times we put things aside, we have careers, we have that, and then we worry about it down the road. But you're saying maybe when his daughter's early 20s, at what point should they start thinking about it?
So listen to me.
Okay.
So
lasers.
Women are born with 1 to 2 million eggs. By the time they're teenagers, that number goes down to 300 to 500,000. By the time you're 30 years old, that number is probably around 200,000 or less. And by menopause, that number is down to 1,000. So by aging, we're already losing a lot of these eggs, right? However, our environment, our toxins, smoking, lack of exercise, our diet, all of it will affect the decline in the egg count and quality. Two main conditions, endometriosis and PMOS, are the leading causes of infertility. They affect your egg count and egg quality. And a lot of these patients, especially with endometriosis patients who are, again, majority of them go through life and they're never diagnosed, right? It takes in this country 9 to 11 years to diagnose an endometriosis patient. These are patients who complain of painful periods, pelvic pain, pain with intercourse, bloating, and the list goes on and on. And because they're not diagnosed, by the time they reach the age they want to have children, their pelvis is scarred, their egg count is gone, their egg quality is gone, and they end up in the fertility clinic. I always say, if you send every 20-year-old woman to my office one time, I will take them out of the hands of these fertility doctors, because if you address these conditions early and you take their symptoms seriously and you diagnose these underlying conditions, you can block them from becoming infertile.
Wow,
and that's why I'm here.
That's kind of huge, and you nailed it with my daughter. They're in their early to mid-20s.
This is what they should think about.
All right,
right?
Prenatal testing has advanced a lot in recent years. You and Haley Bieber discussed this on your podcast. That's pretty huge. Can you walk us through the newer testing options that can help identify risk for preterm, I want to make sure I get this right, preterm birth earlier in pregnancy, and why that insight matters?
So it's very important. Pregnancy is 40 weeks. If a baby is born before 37 weeks, we call it preterm. 10% of pregnant women are at risk of preterm birth, right? Right now, as experienced, I've done maybe 9,000 deliveries, but even as experienced as I am, I can only diagnose 20% of these patients who are at risk. We're missing 80% of these patients, right? And basically, you have to wait for these patients to go into labor, to have signs of bleeding, cervical change before we start treating them. Well, now, through Sarah Prognostics, we have a test called PreTerm. It's a simple blood test. Every single pregnant woman should take this test between 18 weeks to 20 weeks and 6 days. It's a simple blood test, and it basically predicts the risk of preterm birth in these low-risk patients. If you fall into the high-risk category and your test is flagging risk of preterm, what we do with these patients, we immediately start them on vaginal progesterone nightly until 36 weeks. We start them on a low-dose aspirin, 81 milligrams every day. We might modify their activity, and we've been able to reduce the risk of preterm birth before 32 weeks by 56%.
That's huge.
And before 35 weeks by 32%. And we've been able to reduce NICU admission by 20%. All the patients in my practice that I've diagnosed with this preterm test, and I've done the progesterone and the aspirin, and I've modified their activity, I've been able to take them beyond 37 weeks.
Is that common?
term.
Is what you do common, or are you kind of like a thought leader in this area?
Well, this test is available. It's just that patients don't know about it, and many OBGYNs don't know about it. So I'm here to tell them that
They got to request it.
Yes.
All right. Finally, I want to talk about breast cancer risk and genetics, that whole conversation. What do women need to know about understanding their personal risk, maybe family history, that sort of thing?
So I say, if you know your first name as a woman, your last name, your date of birth, you need to know your lifetime risk of breast cancer. And in order to do that, there's a simple formula you can use. I have it on SheMD. It's free. You can go calculate your lifetime risk. It's the Tyrer-Cuzick risk assessment tool that we use to calculate a woman's risk of breast cancer over 10 years and over her lifetime. An average American woman has a 12.5% chance of getting breast cancer. However, different factors affect your risk of breast cancer. Two of the main factors are your family history, especially if you have a first-degree relative with breast cancer. And the second one is if you've ever had a biopsy of the breast that showed atypical cells. But there are other factors like density of the breast and your height, weight, all of it affects your lifetime risk of breast cancer. If your lifetime risk of breast cancer, if you calculate your risk and that risk is 20% or more, you fall into the high risk category, which means you have to start breast imaging as early as 30, not 40. And your breast imaging needs to have 3D mammogram, ultrasound, and MRI, because you don't want to miss that MRI in these high-risk patients. Now, if you have family history of breast cancer, ovarian cancer, you have to ask your doctor for genetic cancer testing. In my office, I do the MyRisk test. I don't know if you've heard of it, by Myriad. They check for 63 cancer-causing genes. The MyRisk test also calculates your Tyrer-Cuzick risk for you in case you don't know how to do it. And in addition to that, it gives you a risk score where they take your Tyrer-Cuzick percentage and they look in your DNA for tiny little markers that can bump up your lifetime risk of breast cancer. Together, that risk score is very informative. Again, if your lifetime risk is 20% or more, you want to be proactive. You want to go ask your doctor for a mammogram and ultrasound as early as age 30. If you're over 40, make sure you add a breast MRI to it.
That wasn't the last question. This is the last question. Unexpected. Tell us about the podcast. I mean, you've had some big names on there. You've got Kris Jenner, Hailey Bieber. We talked about that. Olivia Munn. It's called the SheMD Podcast, if I'm not mistaken. I mean, those are some heavy hitters. I mean, Kris Jenner.
You know what? It's been my passion. I'm so grateful for these women to come on my podcast. They share my passion. They know that I want to bring this information to women. And basically, I did it because I want every woman on this planet to be their own health advocate. Women's symptoms get dismissed in this current healthcare system. So you have to learn to educate yourself. And in order to advocate for yourself, you need to really educate. That's why I started this podcast with my dear partner, Mary Alice Haney, and we just give them all the information they need, and we cover all topics in women's health, from menopause to fertility to everything in between.
Oh, Producer Fawaz has a question for you too before we go.
This is really serious. Can you tell us what Jack Blues looks like, mom or dad?
Oh, she's asking about Haley.
I have no idea what this
Haley,
means.
she's asking about Haley Bieber and Justin Bieber's baby.
Oh, naturally.
I know.
Naturally.
The cutest baby on the planet,
mean,
of
You're
course.
funny for a
I had to. I wasted my whole question
Trying to
for
make
that.
international
Expect
tea.
anything less.
That's it.
Dr. A, thank you
Thank
so
you.
much
Thank you
for
for
all
having
you're
me.
doing, educating
Thank you.
women. For more information on PCOS, what's it called now?
PMOS.
PMOS. Thank you. You can go to OVII.com. Dr. A also has a website you can see as well. Plus, you can catch her podcast, as she mentioned, SheMD Podcast.com for all the information and so much more. We appreciate you.
Doc, thank you.
We'll be
Thank
right
you.
back.
Make sure your daughters listen to my podcast.
You know what? And I want to say this as we're heading to break. At KTLA Plus, the app, that was a very long and detailed interview. I don't think people had enough time to write everything down. At KTLA Plus, we log these shows. You can go back and rewatch everything she just said because there was so much great information on that. Just download the KTLA Plus app off the clock. Coming right back.